Hey, Good Smackers, and welcome back to the Good Smack podcast brought to you by Hey Social Good. I'm your host, Cindy J.
And I'm Kate Hauser, and we're here to talk some smack. Good smack, of course.
Each episode, we interview leaders, business owners, and thought provokers in the world of sustainability and social good in hopes of inspiring you to do some good through more mindful, conscious habits.
Sometimes all we really need is a good smack to wake us up to the issues facing our world and small steps that we can take to help give back. So, Cindy J, are you ready to talk some smack?
Yes, I am. Let's do it. Welcome back to the Good Smack for the Planet podcast. Dr. Priya Vaziri joins us today to talk about physical and mental health. She is a naturopathic doctor specializing in holistic medicine, and we are feeling quite serene and soothed to have her on our show. Many thanks, Priya, for talking with us on Good Smack for the Planet.
Awesome. Thank you for having me, and thank you for the warm welcome.
Yay, I'm so excited that you're here, Priya. Obviously, you and I have known each other for a couple months now, and I've loved all of our conversations. But for those of you who are listening who may be new to the concept of naturopathic medicine, can you educate us a bit on what that type of medicine means and how you became interested in the field?
Yeah, of course. Naturopathic medicine is what I like to refer to as root cause natural medicine. So a lot of what I do is identify what is going on from like the most inner layer to cause these symptoms that are manifesting in someone's body. So it's a lot of holistic medicine. We look a lot at diet, lifestyle, hydration, your bowel movements, just looking at what is happening on a day-to-day in your body to create this disease process. So it's a little different than what people are used to when they go to a conventional doctor because, in my opinion, for a lot of chronic diseases, they do a lot more symptom management as opposed to targeting like what's happening and undoing that. So that's like a little overview on it. And I actually became interested in the field because when I was an undergrad, I was studying biology and I always knew I wanted to go into healthcare. And I was more so like kind of drawn towards the field of pharmacy at the time. But then through my own experiences with my own health and just how frustrated I felt going to different doctors, I found naturopathic medicine and felt drawn to that. And I knew this is the place I want to be. I want to make a big difference in people's health. And that's how I came across it.
And Priya, that's happening a lot, right? A lot of people are finding that they go see their primary care doctor and they have certain symptoms. And maybe because it's not a huge sickness, they're not getting the response they want. Is that part of the reason why there's such a growth in naturopathic medicine?
Definitely. I feel like so many people are drawn to this field. And when they come in, one of the first things they say is, I've been to like this many doctors, this many specialists. No one really knows what's going on. People just want to put me on this medication. There's got to be a different way. And so by the time people come to us, I feel like they've been through the ringer with going to the doctors and they're just frustrated and they want a more natural response. Like they want a more natural treatment. They want something more gentle on their body, but they want something effective. And thankfully we've created a space in medicine to be able to do that.
Yeah, definitely. I also find it interesting that you mentioned that you kind of went into it because of an experience that you had with going to doctors and being disappointed with your own kind of struggles. We find that so much with a lot of the business owners that we interview on this podcast who have started companies or made products because they found that there was like a gap in the market and they couldn't find what they wanted. So they just decided to do it on their own. So I find that really interesting that that was like your path as well.
Yeah, I feel like that personal experience brings so much more passion into everything that people do. If you have something in your own life that really pushes you towards something, it's going to be that much more effective when you pursue it. So a lot of people in my field had similar experiences to me where their health was very mismanaged and then they took things in their own hands and then found naturopathic medicine.
Yeah, I would say for our team at Hey Sister Good, mental health is really like top of our mind. And I think particularly because of, what's happening right now, both here in, in our country and around the world, mental health is really important. And so why do you think it's so important now more than ever for people to prioritize their mental health?
Mm-hmm.
And maybe explain a little bit like what mental health is I feel like there's a lot of definitions too.
Yeah. I personally believe mental health is the foundation of your health. Your brain controls so much that happens in your body, and we're understanding more and more every day that so many processes that happen, especially when someone has a mental illness, can affect the rest of their health as well. So when I look at mental health, I think of like emotional, mental, physical, and spiritual health. It's everything all at once. And like you said, now more than ever, it's important for people to be mindful and take into practices that will support their mental health, because with everything going on, a lot of people feel isolated. There's a lot of people that are scared for the future. The uncertainty of everything really messes with someone's mind. And I think this whole event has been a layer of trauma. And we know when someone's exposed to trauma, that stays in the body in different ways. And that triggers in different ways for different people, and it manifests differently. So this has been a very interesting experience. And I have friends in the mental health industry that have said their numbers have skyrocketed with patients since everything's happened, because people need that support. We're living through a really unprecedented time.
What are can you give us some examples of some of like these, you mentioned trauma, and I definitely heard of that. And I agree with you. Like, I think this is like, it's that silent layer of trauma, but what are some of the, I guess, result or the way our body responses that you've seen? I mean, obviously I feel like stress, like you said, uncertainty, but in terms of like health complications that we might go to our normal primary doctor, like what are some of those things that people might know or not know about?
Yeah, definitely. So when I think of someone who has had a history of trauma, and now they're kind of in this state of being chronically stressed, and usually when people go through something traumatic, it creates a system in the body where the nervous system reacts more quickly. Like before, you could have had a more healthy stress response to something, but now that you've been traumatized by something, it takes a lower threshold for your body to go into that flight or flight state that we call, where you get stressed out, you're releasing cortisol, adrenaline, and things like that. And so when someone's in a more sustained period of time, when they're stressed out, what can happen is that stress can impact other functions in your health too. It could start impacting your gut health. You'll see people come in saying, I feel bloated, I get stomach aches every time I eat, what's going on? And it's because they're chronically stressed. You might see that weight gain or weight loss that people can't seem to fix no matter what they do. You might see poor sleep. You might see appetite dysregulation, obesity. So there's a lot of things that can happen when we have a period of time where stress goes unchecked and people aren't taking care of themselves. And just, it's like cortisol is such a big hormone in the body, and it affects so many other hormones and processes. So there could be a lot of things that happen that people come in for, and the underlying layer could really just be that you're stressed and your body doesn't know how to handle stressors and trauma anymore.
Right. And to your point, there's not a pill that can fix that.
No, unfortunately not. I wish it was that easy.
It's crazy to think too that, like, obviously one of the biggest traumas that we're talking about is everything that's going on with COVID, and COVID in itself is such a beast of a disease. But then to think about all of the other physical and mental impacts it's having on like our species, pretty much, it's like crazy. But I'm curious, so if you have like a new patient come in, especially right now, where do you start when you're diagnosing them? I mean, obviously you consider physical and mental health, it sounds like. What does that process look like for kind of evaluating what their issue could be?
Yeah. So when people come in, generally on a first appointment, my appointments are like an hour long, and we sit down and we really talk about everything going on. So someone could be coming in with like a chief complaint of poor sleep, for example, and we really go through it. When did this start? How did this begin? What are you doing for it? Has anything helped? Has anything made it worse? So really going at it from every level to understanding it. And then we dive into family history, personal history, medications you're on. We go into all the lifestyle factors like diet, stress, sleep, hydration. We just go through basically every layer of health possible, and then piecing everything together. You could sometimes get a good idea of, well, I think this might be the root cause, or this might be the root cause. But then certainly at that point, recommending lifestyle medication and doing more testing if it's necessary to identify what really is happening. So it could be a long process, and I tell people all the time, when you go to natural medicine, it's not a first appointment, here's a solution, there you go. It's a lot of investigating and putting pieces of the puzzle together, because it takes a long time for people to get to a certain point in their health. So it's not going to be undone like overnight,
Yeah, definitely. So I'm like a serial WebMDer. Like, don't get mad at me because we're friends. Have to be nice. But I will really like look everything up on WebMD, and then I'm the worst patient. Like I go into the doctor and I'm like, okay, this is what I have. Like, what can you give me for it? And they're like, no, like that's literally not what you have. You're wrong. And I'm like, well, I feel like I've self-diagnosed. But have you had cases where people have been like completely like surprised by what the actual root cause was when they came in thinking of something and it was like something totally different?
Yeah, I find that a lot of times it'll come down to a lot of lifestyle factors that we can change for someone and someone can feel a lot better. But a lot of people don't want to hear that because one, that's hard work for them because they have to undo a lot of habits that they have. But also, I don't know, there's something about, I do this too. There's something about people going to the doctor and just wanting like this diagnosis because you're like, you have it in your head, you have it solidified, you know what the treatment is, you're just so like attached to it. And it might be completely out of left field. But yeah, there's definitely people that I do that. I see people come and do that, but yeah.
I think too, like that's the idea, right? Because as you're describing like this whole holistic or just kind of the big picture of looking at your life, a lot of it's about self-awareness and getting to know yourself, right? So like in order to change a habit, I have to first know what habit I've made that needs to be changed. And so that's what takes time, right? Because I have to understand myself. And at the end of the day, it's a really fantastic process, but it could take a while and it takes self-investment, which is not always easy to do.
No, definitely not. And it does take a lot of hard work and commitment to be able to heal yourself naturally, in my opinion. It's not an easy process, but it does set you up for a better life down the road. So a lot of times, like what I learned all throughout school is meet the patient where they're at. Like I could have so many great ideas for someone, but if someone is just not ready in their life to do that, you have to be able to work with them and create like smaller habits that'll build up to that eventual bigger change. Yeah, it does take a lot of self-awareness and hard work to get there.
Definitely.
Oh, sorry. Can you give us an example of someone who's kind of gone through that process? Or just kind of like where they started and where they ended?
Definitely. I could give myself as an example, actually. I feel like, I mean, growing up when I was a teenager, I ate poorly. Like, I didn't really understand much about nutrition. I was all about fast food, soda, all this stuff. So it took me a long time to kick habits. And it wasn't until my health was at a place where it was so poor that I had to make changes. Like, I just felt horrible every single day. I would wake up, I had anxiety, I had a lot of gut issues, and I had hormonal issues, and it really was a product of the lifestyle I was living. And I will say that even to this day, it's still a work in progress. I've been on the path of being natural and holistic for about, I would say, 6 to 7 years now. And there's still times where I'm not perfect. And I don't think anyone will ever be perfect with their diet or their lifestyle. It's really hard to be in this day and age, you know, with the way that we all live, the way society is set up, it's hard to want to always prioritize yourself and your health, especially when there's a lot of really easy options to grab onto and convenience and things like that, which may not be the best for us. But yeah, I think every day I learn more about what else I could do to support my body. There are times there'll be like sometimes a month in a row where I don't really prioritize myself. I talked about this a lot on my page, but when I was in the process of taking my licensing exam and studying for it, you know, self-care was out the window because I was so stressed and busy, and my health definitely reflected that as well. So I think it's a continuing journey, and to anyone that wants to embark on it, just be patient with yourself, know that there's going to be ups and downs, and just like I'm sure in the world of sustainability, there's always room to do better, but you don't have to be 100% of the time.
Yes.
Absolutely. Yeah, we preach that. We try because we don't want people to be afraid that they have to be perfect, you know? And you talk a lot about like the different lifestyle changes and how it is small habits leading up to that one big habit, which I love. And I follow you on Instagram, obviously. And I know you post a lot about, you know, shopping organically and different, you know, good vitamins to take and things like that. So kind of like going into the concept of sustainability, what does that mean to you, and why do you think it's important for someone in your field to understand and promote?
Yeah, I think it really goes hand in hand. You know, in our field, we preach holistic wellness, and in sustainability, it's wellness for the planet. You know, you can't have one without the other.
Right.
You need a healthy planet to be able to make these healthy choices. And I really love the direction things are going in with sustainability in terms of prioritizing local farmers and like going to farmers market and things like that, because that really does support higher quality food, shopping seasonal, doing these types of things, because when we're supporting our body seasonally in that way, as well as supporting like all the local farmers, you see like this beautiful union of these are foods that are meant to be eaten at this time, so they're really nourishing for your body, and also you're not having something shipped from hundreds and hundreds of miles away. You know, it's cutting down on emissions, it's cutting down on expenses, and again, you're supporting local businesses, which is so important in my opinion. And I think when you start to shift towards, at least what I found in my personal life too, and most people I know, when you start to shift towards natural medicine, you kind of inadvertently shift towards sustainability, because a lot of these companies go hand in hand with each other. So it's nice, you know, we're working towards like overall wellness together.
Yeah, that's exactly. I'm so glad you couch it in that way, which I don't know that people always think about it, because it is actually a really hard concept even for myself. But this idea of you want wellness for yourself, in order for there to be wellness for yourself, there's got to be wellness around us. So obviously that's the people around us and the planet around us. And I just love that you mentioned local farmers and the kind of higher quality nutritious food. It's like this whole circle, right, that we're building, which then goes right back into what you're saying about naturopathic medicine, which is this whole circle too.
Mm-hmm.
Yeah, that's just awesome.
Yeah. It also, it makes me think about, which I'm not going to talk about it right now because we could talk about it for days, but it's also, if you have the ability to have access to healthy food, then you're way more likely to be healthy. But Cindy and I love food justice. We could talk about that forever, but that's what's something that came to my mind when you were saying like, it's important for us to have that. So it's important for us to make sure that everybody can.
I agree 100%.
So, as a woman entrepreneur and as a doctor, what sort of challenges kind of, you're doing a lot, because on the one hand, you're trying to create a wellness program, right, via naturopathic medicine. And I don't think it's an easy space, just like sustainability is not an easy space, but it's making that kind of, steps of progress. But also you're an entrepreneur too. And so can you share with us, because one of the things we always like to kind of dig a little bit with our guest is how their journey has been and how you try to really live that purposeful vision in your life, but also building a business. So what are some of like the, I would say challenges or any things that you faced? And can you share that with us?
Mm-hmm. Yeah, I think right off the bat, just being a woman in this field, and also at that a younger woman. I'm 27, so I'm a young doctor, and I'm also a woman as well. I think it's harder to just garner that respect sometimes, and to have people recognize that I am smart, that I know what I'm talking about, that I'm not just here doing whatever. And I've come across it in, it's almost like these microaggressions I come across, where people will say stuff to me where I'm like, you wouldn't have said that to me otherwise. Like, I've had an old boss of mine say to me, oh, I didn't think you were this smart, and it just caught me off guard. It's just like these little things where I'm like, what about me just makes me seem like I'm not that smart. You can't judge a book by its cover. So I think I almost feel like I have to put in a lot more effort to seem professional and to be taken seriously. But at the same time, I'm not like this super serious person either. I'm not like always like super strict, super stern on anything. I don't really have that mannerism. I'm definitely more of like, Kate knows me, I'm definitely more like gentle, I'm more laid back, and I really try to use that too to my advantage. So it's like this weird balance of like, I really want people to like take me seriously, and I know I have to work harder at it, but I don't want to be someone I'm not. Like, I'm not gonna put on a whole show just to impress anyone. And I think a lot of women go through that, where they want to be taken seriously and they have to like be like, quote unquote, like the boss bitch and like all that stuff. But that's not necessarily maybe true to their personality, but they have to go at it that way to get more respect. So, and I'm sure you guys experience it too, just trying to make strides in your field and maybe not necessarily getting always the respect that you deserve in it.
Definitely. I definitely relate to the like that comment that for that example is like, he prejudged you like off of nothing. And then to say something like that, like, I feel like as a female, like, and a young female as well, like, kind of going in, you're kind of already a little bit behind and you have to put on this facade, and maybe be someone that you're not, even though, because you're just protecting yourself from being judged for who you are. And it's like, but you didn't even do anything, you're kind of already set back. So it definitely is a challenge. I don't know, Cindy, if I mean, I don't know if you've experienced that either.
Yeah. Yeah, I think you're right, Priya. I think basically most women probably have encountered those microaggressions, and frankly, it's hard, right? It's hard to overcome it, especially when it's repeated. I mean, I come from a science field, so I mean, similarly, like, right, where people have all these judgments or impressions about you, and I totally get when you say you have to work really hard to be taken seriously. Like, I remember I will dress a certain way to look, older or more professional. And then at some point, I'm like, that's not me. I don't want to be that way. And I really think what I really appreciate you is kind of giving voice to that on this podcast, because I think that in order for that to change is for us to talk about it more and to share that. And other people feel the same way. Or like, oh, I didn't realize it was okay to talk about it. Right. And then at some point, it's like we have this collective force of, women and men who feel like, wait a minute, that's not how it should be. And then we can kind of make that really push to change things. So yeah, definitely.
Yeah, I agree. The more we talk about these things, the more we just put it out there and people feel less alone in these experiences.
Totally.
Yeah, I agree. And it kind of all ties back to like our concept of mental health, of just like kind of already having like those doubts and those concerns and that anxiety and that stress in your mind of like, you know, am I going to be set back? Are the people going to judge me? Am I going to be at a disadvantage by something that is completely out of my control? Like, so I feel like, I don't know, I feel like for our listeners, if somebody is, feeling those type of emotions or going through that type of experience, like what would you suggest would be a good way to kind of combat those fears and anxiety? And it can be about this specific topic. It could be about anything, just with mental health in general.
I would say it's recognizing that no one's opinion of you matters. What matters is your own opinion of yourself. So I know that's way harder to take in than to just hear it. But, like we talked about, these microaggressions, they build up over time, and you can have those underlying doubts about yourself already. And it creates like this perfect storm of having imposter syndrome, where you're in this space and you keep telling yourself, well, I'm not good enough for this. I don't know what I'm talking about. And then that's fueling all your doubt. And it's inhibiting you from showing up and being your best self and putting out there everything you can. And it's going to hold you back from your goals. So I think it's really taking that time to work on self-love, which I think is going to always be an ongoing journey for anyone. I think with the society we live in and the way people are with each other and the way social media is set up, no one's fully going to have 100% self-love for themselves. Like, it's going to be something that we all have to always kind of work through. And it's just having those practices of reaffirming all the good things about yourself and loving yourself and understanding it's important to be gentle with yourself too. Like, you don't have to be the best at everything all the time to love yourself. You don't have to be super productive all the time to earn that self-love for yourself. You're allowed to rest. You're allowed to take time off. You're allowed to treat yourself and be kind to yourself. And, in the society we live in right now, I think the opposite message is sometimes preached, where resting is not really like being productive, and success is ranked so much higher than rest and relaxation and taking time for yourself. So it's a tough one. It's really tough. Yeah.
It is. I think you're right. And it's funny you say self-love, and it's so true, but I have to tell you, I know so many people, particularly women, who have a really hard time with that concept. Like, are there, I don't know, maybe little tips or tools? And maybe it is just, like you say, telling yourself, but like, I'm just thinking of a few friends in my mind where if I said that to them, they're like, well, give me all these reasons of why not. And sometimes I feel like, how do you give yourself self-love? Like, how do we start with, I wake up in the morning and then like, hey, I'm okay. I don't know.
Yeah, that's a good one. I think The first thing that came to mind is this really powerful exercise I do with my therapist, where she'll have me say all my negative, like self-limiting thoughts. And right after that, we'll go through and dissect it and write down sentences that directly negate that. And then I have these all on note cards, and twice a day I'll read them. So it's taking that inner negative dialogue and reframing it and erasing it and filling it with positivity. And it takes a while. It does take a while to feel that, but I have certainly felt like some of my negative self-talk go away the longer I read and told myself the flip side of it that was positive. So for example, like, if I think a big one for a lot of women, and there's a huge movement right now with diet culture and all that, it is accepting your body as it is. So on a note card that I'll have is my self-love and self-worth is not tied to my physical appearance. And that's like a really powerful statement to tell yourself every day. And it could be in whatever language is comfortable for the person reading it. It has to be in your own voice, and it has to be something that will stick with you. And that has been life-changing for me, honestly.
Wow. I love that. I love that it seems so, I mean, not easy, but doable.
Yeah.
Like that is so, I'm going to start doing that.
Yeah.
Oh, I love that.
Your brain, it really does. Like you will notice the little ways in your life moving forward that you have more confidence, you have more like compassion and gentleness with yourself the longer that you do it.
Yeah, I love that. Especially the one that you would like, the one you mentioned about like your, your physical appearance. Like, I feel like as a female, like those thoughts of doubt, self-doubt based on that come in your head so often. And like, I've even been, sometimes I'll walk past a mirror and I'll look and I'm like, why am I even looking at myself right now? Like,
Right.
this isn't, and you're just like, and you immediately find like the one thing that that is bothering you about yourself that day. And it's like, I don't know if men do this too. Maybe they do. I'm sure there are some, but I'm just like having those reminders throughout the day. Like, I'm definitely someone who, yeah, I could use that myself. I'm going to practice that.
Sure. I feel the same way. I think most women in our society feel that way.
Yeah, I think so. I think something about it. I mean, it's, you had mentioned that too. It's like what's around us, right? Like what we see and with social media and just kind of on a daily basis, it's hard to hold the mirror up in a way that reflects our authentic self. So I think that's a really good reminder of like, do this simple act, even though it takes a lot of thought and time. But it's totally doable. Yeah.
Yeah, I have one question that might kind of tie in both of your experience with both being a physical doctor and also having so much expertise on mental health. For someone who is struggling with their mental health right now, like probably majority of the people in the world, what could they do? Like, what are some physical things that they could do to help their mental health? Like whether it's certain foods that they should be eating or certain supplements, or if it's exercises. Obviously you mentioned the note cards. I think that's fantastic, but anything that you can kind of maybe even like digest like physically to help your mental health. Like, what would you suggest for that?
One of the biggest things I could recommend is eating well-balanced meals, getting breakfast, lunch, and dinner in, because one of the worst things you could do when you're stressed out is to not eat. And usually people, when they're stressed, people won't eat and then they'll caffeinate. And that sends your blood sugar like all up and down. And when your blood sugar is spiking and dropping, that's going to make your stress hormone cortisol act way crazier than it already is. So it'll just amplify whatever stress and anxiety you're already having. So making sure you even though it's really hard sometimes when you're stressed, I have a hard time eating when I'm stressed out. It's really important to try to eat at least 3 times a day, something balanced, so your blood sugar stays stable. And then another one of my favorite practices is a thing called contrast showers. And what you do is in the shower, you'll do like 5 minutes of hot water, 1 minute of cold water, and you'll alternate and you'll end on cold. And what this is doing is essentially it's great for circulation in your body, but 2, it helps train your vagus nerve. And your vagus nerve is the nerve in your body that is responsible for your parasympathetic nervous system. And that is the branch of your nervous system that helps you relax. It puts you in what's called rest and digest. So it creates this resiliency in your body. I talk a lot about stress resiliency because stress management is important, but it's also important to build a more resilient nervous system so that you're able to handle stressors better.
That is I've never heard of that.
Mhm.
I've heard of like running fast and running slow, but it's interesting. Like as you're talking about, I'm like, that's just like running, but in the shower with hot, I don't know, cold and hot water.
And it's so easy to do. People shower. I think people shower every day. You could do it. It's
These days, I don't know, with everybody being at home. I've pushed it.
Mhm.
Yeah, that's crazy though, because you're just basically shocking your nervous system in that way. And it's kind of like waking it up and getting it to be more, I guess, safeguarded when something comes through that would naturally shock your nervous system. That might be something mental.
Yeah, it's awesome. I love it. I'm addicted to it now. Now that I've been doing it long enough, like I crave like the hot and cold contrast when I'm in the shower.
And it's interesting too, because we're so sedentary for those of us who can work at home or have to be inside more often than before. It's a really just a kind of an alternative way to shift, right? Like your nervous system, like you say, because I think a lot of people's go-to is like, well, I'm going to go for a run or I'm going to do some exercise. But which is where I thought you were going to go. But in some ways, this is simpler to do because, like you say, when you shower, just do this one thing.
Mm-hmm. Exactly. Super simple tip.
So maybe I was going to ask you, I mean, we kind of like touched on it, but how do you think COVID-19 has impacted this field of naturopathic medicine?
Mm-hmm. I think it has shifted it in our direction in a good way. I think a lot of people are now realizing that the healthcare system has not been doing them justice because a lot of people have a lot of these chronic diseases that puts them at risk for COVID. And a lot of these chronic diseases are things that could have been easily reversed with lifestyle medicine, which is a lot of what naturopathic doctors do. And so there's this transition towards, instead of how do I rely on medication to fix me, how do I make my body stronger so that when things like this happen, I'm not at a disadvantage and I'm not part of the at-risk population and things of that nature. So I think a lot of people have been coming towards naturopathic medicine for immune system support, working on their chronic health, working on optimizing their diets, just making themselves healthier because they realize that, you need to be.
Right, right. Which totally makes sense. So if you're someone who's listening or have thought about naturopathic medicine but don't know anything about it and don't know anybody who knows anything about it, what's a really easy way to try to find a naturopathic doctor?
Yeah, definitely. So, oh shoot, the name of the website slips my mind, but I will provide it with you. But there is a website that you go on where you could type in what state you're at and it'll pull up all the naturopathic doctors in the area. And I would also say I always advocate for social media because I feel like there's a lot of people putting great information out there and it's easy to find and it's easy to follow along and learn more about naturopathic medicine through those platforms and then decide if it's right for you and take the steps of finding a doctor in your area.
Awesome. And how can people follow you? I mean, I follow you on Instagram and you post really great content like every single day and it's stuff that I didn't even know sometimes. So how can people, just kind of connect with you and get out there? I know you're super involved with engaging with your community and everything.
Yeah. My Instagram, I would say, is my biggest platform that I interact with people on, and you can find me at dr.paria. And then my website, if you go on it, www.drparia.com, you can type in your email. I send out a newsletter. I send out updates about appointments, programs I'm running, all sorts of good things. So those are the two platforms I'm using right now.
Awesome. And we'll include those in our, obviously in our podcast information so people can get in touch with you. You posted one the other day that was like cooking things to avoid and cooking things to do. Like I didn't realize that, like, is it like the non-stick or like terrible for you or something, like pans, like things in your everyday life that you don't even realize that you're doing that affect your health. And I was like, oh my gosh, I need to do I need to flip my whole apartment.
I'll inspire you to change everything up.
Yeah. Well, if anybody needs to change their habits and you learn from Priya and then you need some new products, check out Hey Social Good for some of our products.
Exactly. And I'm so glad, Priya, you mentioned about probably nonstick pans, which actually has a coating of chemical on it that we should avoid. So just for those of you who are listening, use stainless steel or iron skillets. Those are really great alternatives, but definitely, Priya, this has been so wonderful. And I love that you gave us an insight into the connections, which is really hard to do, but like connecting kind of our mind, body, and soul, along with our planet. So thank you so much.
Yeah, you're welcome. This was great. Thank you so much for having me.
Yay. Thank you for coming. It was good seeing you as always.
It's great to see you as well.
Thank you.
Thanks for listening to this episode of Good Smack. We hope you've enjoyed talking smack with us.
And don't forget to check out Hey Social Good
Hey Sogo for short.
to learn about all of the other awesome brands out there giving back to the world and our planet. Until next time, Good Smackers.